Hello, and welcome to Williams Mullen's Benefits Companion, a podcast that helps employers navigate the complex legal challenges of managing their employee benefit plans. I'm your host, Brydon DeWitt, and today I'm joined by my colleague, Allison Carlon, a benefits attorney in our Richmond office and a first-timer to our podcast. Welcome to the Benefits Companion, Allison.
Thanks, Brydon. I'm happy to be here today.
The Consolidated Appropriations Act was a massive 5,000-plus page piece of legislation that included appropriations for the U.S. government funding for coronavirus emergency response and relief, among many other things. And while the act, I guess is best remembered for making some $900 billion in COVID-19 relief stimulus, the law also included a series of important benefits-related provisions, including health plan transparency requirements. Allison, I know some of these requirements are effective in 2022. Some of them have delayed effective dates. What do employers that sponsor group health plans need to know about the CAA's group health plan transparency requirements?
Right. So, like you said, some of these have already taken effect for plan years that began January 1 of this year. Some of those provisions include the health provider directories requirements, disclosures on balance billing restrictions, cost sharing disclosures, and the continuity of care rules.
Yeah, so talk about each of those requirements that are currently in effect.
So we have the health provider directories requirement that starts once again for plans beginning January 1, 2022 and after. Under that requirement, the plans must establish a process to update and verify provider directory information, and that information must be made available on the plan's or insurer's website. They also have to establish a protocol for responding to various requests about a provider's network eligibility. For now, since there hasn't been a lot of rulemaking relating to these requirements, we're still in a good faith, reasonable interpretation of the law compliance standard when we're looking at enforcement here. So we have health provider directories. Then we have the plain language disclosures on balance billing restrictions. Now, for anyone who doesn't know, balance billing is essentially when a medical provider will bill patients for any amounts not paid by their insurance. Some states have restrictions on this. There's some federal restrictions. And this requirement is saying that there needs to be plain language disclosure of those restrictions. So the notice must be made publicly available. And there is actually a model notice, though, that the departments have put out, which is very helpful for employers going forward.
Right. So an employer can use that model notice and then, I guess, post it on a website and make it publicly available that way.
Right. So we have that. We have, like I mentioned, also some cost sharing disclosures that need to actually be placed on identification cards for participants. And then continuity of care rules, where we have plans that need to incorporate certain protections to ensure that their participants have access to continuity of care in instances where that insurance may terminate.
And so really, some of these requirements are going to be handled by third-party administrators and insurance carriers. And so employers with these requirements that are in effect now and the ones that are upcoming, I think it's important for employers to just confirm with their TPAs and insurance carriers that these requirements are being met.
Exactly. Most of this will come down to those insurance providers needing to implement, but it will be on the employer to ensure that the plans that they are offering work with insurance providers.
Those are the requirements that are in effect now. What are some of the upcoming requirements?
Yeah, so we have several upcoming requirements, including the pharmacy benefit and prescription drug cost reporting that's going to be coming up. There are reporting requirements that are going to take effect for the 2020 and 2021 plan years, but there has already been deferred enforcement of actually having to report on those years. So right now, the departments are suggesting that employers be ready by December 27th of this year to report on both the 2020 and 2021 data. After that, we'll be looking at June 1st deadlines for reporting on any of that information.
Yeah, so what we have is they deferred the enforcement for a year for 2020 and 2021. And then, so that data has to be reported by December 27th, 2022 of this year.
Right.
But then after this year, employers should understand that it's a June 1 requirement, another annual reporting requirement, that June 1 will be the date to keep in mind.
2020, 2021 data they need to have in by or be ready to report on by December 27th. But for 2022 data, for example, the deadline will be June 1st, 2023.
Okay.
On there. So we also have the price comparison tool requirement that is coming up. That requirement, however, has deferred enforcement until plan years beginning January 1, 2023. So there's a little more time for that requirement to be implemented as well. I'd say we do have, for the Consolidated Appropriations Act, it interacts very closely with the transparency and coverage rules as well. One of those requirements that we have coming up that relates to that interaction is going to be some of the machine readable disclosure rules for in-network and out-of-network coverages on there. So in disclosing the rates for in-network versus out-of-network. We had a deferral on that based on all of the changing legislation. So there's deferred enforcement, but that is now going to be effective coming up pretty quickly, July 1st, 2022, for any plan year beginning January 1st of this year.
So that is right. That's approaching pretty quickly. So as of July 1st of this year, plans and insurers are going to be required to publish on a public website machine readable files disclosing in-network rates and out-of-network allowed amounts and bill charges. So that's something that TPAs insurers should be on top of. Employers need to make sure that this is being taken care of in short order.
Exactly. That covers it really for what we have deadlines that are coming up for enforcement, really under the Consolidated Appropriations Act. There are some other requirements that down the road will take into effect, but we don't have any deadlines set for them right now. So one being the advanced explanation of benefits requirements. But in the meantime, there's a lot of rulemaking that has to happen on the health care provider side before that can even be implemented for plans. So there's a little bit of reprieve there.
Okay, well, Austin, thank you so much for coming on the Benefits Companion and discussing these new and current transparency rules.
Yeah, thanks for having me. It's a pleasure.
That'll wrap up our discussion. If listeners have any questions or suggestions for future episodes, please contact me. You can also visit our employee benefits page at williamsmullen.com/employee benefits. There you can find out more about our team as well as past episodes of this podcast and legal alerts. And finally, be sure to subscribe to this podcast to be notified when our next episode posts. Thanks for listening.